Matt's one of the leading thinkers in functional medicine, really quite a spectacular brain on him. He represents, at least in my book, where the future of medicine is and is going. Conversation today is going to be broad. I hope that you listen carefully. There's a lot of novelty in terms of the conversation that Matt and I will be having with you today. And with that said, Matt Cook.
Thank you. Thank you so much. I'm super delighted to be here.
You know, there's a number of things that I'd like to bring up, Matt, that I know you can pretty much address in terms of protocols, products that are redefining medicine now. There are individuals in your field that I admire greatly that are also defining what the future of medicine is going to be like. I think Peter Attia has spoken about in terms of medicine 2.0, and we're moving into medicine 3.0. So I'd like to get a sense of how you practice medicine 3.0.
Oh, this is a good one. So I think the way to think about that is how taking total control of everything in your life. And so part one is lifestyle. And so then that's just getting all the products that you buy, everything you put in your mouth, everything you drink, and basically detoxing all of the negative things that we've been sort of just allowing to be kind of put into our body and our environment. Number two would be sort of this sort of explosion of technology and diverse strategies that is biohacking in general, and then bringing that into a regular routine in your life, that's just part of something that you do to manage inflammation, manage stress, and optimize, life. And so daily sauna, daily cold therapy, all daily exercise. And then part three then is being empowered to take control of biology. And then how do we do that? And then it's essentially I'm a product operational person. And so there's just a big diversity of product, which you've heard about stem cells. Stem cells make growth factors called exosomes. In our body, our cells communicate, and probably one of the primary ways they communicate is either with hormones or peptides. And then there's a huge diversity of other biological agents, monoclonal antibodies, and nutraceuticals and vitamins that you can take. And so then medicine is collectively putting all of that together in a thoughtful way, and then meshing that with what is exploding right now, which is the opportunity to test yourself and then figure out what's going on, and then basically sit back kind of like you're a hedge fund manager, and then just manage all of that risk out of your portfolio. And so then that, to me, that's the beginning of medicine 3.0.
So if I wanted to find out more about my biology, in other words, if there are treatment protocols that I want to pursue, whether it's use of peptides, and I just heard about them, or I'm already deeply in, like I'm already hacking enough stuff, then how do I determine what are going to be better hacks for me, whether it's dietary, whether it's nutraceutical, or if I want to come to you and I've got particular health concerns? How's the best way to penetrate the way to collect information? What are the best portholes in that regard?
So that's a good one. And so then at some level it's personalized, but I think my goal is that we collectively as a community push all of the information out so that it's fairly understandable and approachable, and then everyone begins to realize that they can do this. And so then, one thing, my real good friend Mark Hyman started this company, Function, and so then what used to be, if you wanted to do a cash pay rate and just check all of your labs, not functional medicine labs, but really just the traditional Quest labs that are inflammatory biomarkers and everything like that, might be $2,000 or $3,000 or $4,000, and now you can do it all twice a year for $500. So you start to get data there, start to do some functional medicine testing, start to do little studies on yourself, I just said, I've had it, and I'm just going to 100% stop eating any processed food. And it's kind of like, it was like another level, and so then I just said, I'm just going to do that. And so then, and then I started talking to people about it, and then somebody just sent me a text. They're like, you can't believe it. I'm on tour. My band is doing all this crazy stuff. And I kind of saw them, and I was like, oh, it's crazy. And then they're like, but now I do the same thing, and I feel great, and I lost 15 pounds, and it's like all this stuff. And that was basically like a throwaway comment that I just casually made. And so then, I am a fun person. And so if you told me, if you told me at any point, including today, that if I quit doing everything fun, I could live 10 years longer, I most likely wouldn't do it. But I'm telling you, it's actually pretty easy. And so then if you have that mentality, then I think, and then product, product at every level kind of makes it easier. And so then the better we hack our biology with these things, the better we do.
So let's talk about more hacks in terms of our biology, but going to diagnostic testing. So you just mentioned one. On a hierarchy of diagnostics, recently I did a test called Gallery, right? So Gallery is a blood test. Some of you are familiar with it. And it will test for 50 cancers in your body, primarily by scoring out the DNA signals that are being pushed out by tumors. I came back with 0, thank God. But I wanted to know about comparative ways of testing for cancer, for instance, or extreme concerns. Like now, full body scans are becoming more popular within the conversation that biohackers are having, and it's spilling over into the public at large. I'd like to hear your thoughts on those particular tests.
So then I sort of orchestrated our thoughts into sort of 10 pillars of medicine. And so then one of those pillars is preventing cancer. So there's Gallery, and there's a couple other liquid biopsy tests. And so then I just did it myself, and it's like, maybe $950 or something like that.
Correct. And
then those 50 cancers, then neither of us have. And so then that was like kind of like a sigh of relief. The whole body MRI I'm doing for myself and most of our people on a yearly basis. And so then that's like $2,000, but maybe a little bit more depending on if you look at fatty liver and stuff like that. That will look at all of your solid organs and all of your organs and is a cancer screen. The imaging that it does at a musculoskeletal level is a screening test. It's not an amazing test if you want to understand what's going on with your knee, but it's a good overall screening test, and so I think it's useful. There are a handful of more sophisticated liquid biopsy tests that, we've been trying to understand how ready for prime time they are for 6 years. And this is at some level across the world and across different health platforms, but that is hugely going to be a big trajectory of growth. And so then I think on a cancer screening front, it's super important to do that stuff. And we've had a couple people with pancreatic cancer that we picked up, referred to surgery, had it taken out, and basically it seems like they're totally cured. And that, would have been somebody that would have had metastatic cancer before they found out about it 2 years from now. So, I think the preventative medicine component is huge, and we will see basically an exponential growth on that side of the equation. And so whatever I'm telling you now, I'm going to tell you something like 5 times better next year. And so then what I would do is I would do sort of the most state-of-the-art thing that we have now, and then sort of alert yourself at a consciousness level that then you could pick and gather data. Now, if you said, hey, okay, let me ask a different question. What's the cheapest thing that you could do that would have more data around it and then more possibility to change everybody's life on the planet? And could you do it for like $10? And then I would say, yeah. So then for like $10, you could check hemoglobin A1C, which basically measures how much sugar you're putting on your. It's sort of a 3-month average of your blood sugar, and if you knew that, and if that was high, and you could optimize that. That's the number one problem that the world faces right now. Insulin resistance, diabetes.
Well, if you're going to measure hemoglobin A1C, then would it be useful to consider using a constant glucose monitor now, outside of being a diabetic? And why would you want to check in on your blood that often, or not?
So then it's amazing, because what happens is on all of these topics, there's basically a spectrum. And so you heard about the spectrum of there's somebody with autism and they can't get out of bed, but then we all saw that movie with Dustin Hoffman, Rain Man, and he has some special abilities, but they're on a spectrum. And so then diabetes and insulin resistance are probably somewhat on a spectrum, and there's probably a lot of people in this room, and maybe even us, that would have relatively good blood sugars all day. But then if we went over and had gluten-free chocolate cake at the restaurant, we might have a little spike. And if you could just sit with your phone and then just put it up here and look, and you see, and you get that data, that feedback all day long, then what I have found is that's an incredible tool, and it's a super powerful tool that I have used with tons and tons of patients who love it, who now actually have really clear understanding of how that first part of our conversation today, what we put on our body, affects us at a metabolic level.
So we know that type 2 diabetes is a huge problem with the culture at large right now, and for a multitude of reasons. For the average individual that may not be moving towards type 2 diabetes, what's the damage of refined food products, the high consumption of sugar, showing up with an elevated hemoglobin A1C? In other words, there's, like you said, a spectrum of damage that happens before type 2 diabetes occurs. So what's the damage that occurs with sugar?
So the damage of sugar kind of, I guess I would say, kind of oxidizes us. And so if you took your car and parked it by the ocean and left it there for 6 months, come back, it'd be all rusted. And in a way, eating sugar kind of does that. And so then there's an evolving functional medicine testing sort of looking at this. I think once you can begin to take charge of this, then that oxidation in each organ system, when it oxidates, when high sugar and fatty and processed food, I think the first thing that happens is people get inflammation in their small intestine. It causes leaky gut. Now, in parallel to that, a lot of times they're on the spectrum of either fungal or bacterial overgrowth in the small intestine. And then the combination of inflammatory foods and a little bit of fermentation that's not supposed to be happening in the small intestine, causing leaky gut, starts to send a whole bunch of stuff to the filter, which is your liver. And then as soon as that happens, that plus sugar creates fatty liver. Basically, like that's what's happening in the world. And so then what happens as a result of that is that creates stress in one of our major systems. And then the consequence of that is that is the first step in metabolic syndrome, which is insulin resistance, hypertension, and diabetes. And then there's going to be like 1 billion people on the Indian subcontinent with diabetes in 10 years, I think. And so then you're just looking at massive healthcare costs that across the world from this. And so then we thought maybe, this processed food is going to be an easy way to feed the world, but it's going to be an easy way to make the world sick. And so then we just have to manage changing that narrative. And then the best way to do that is to change the narrative of what we do, what we put in our body. But then everything that we have helps those things.
You brought up 2 points that I think I'd like to elaborate on and know more about. So we're talking about oxidative damage and inflammatory damage. Can you drill a little bit deeper in terms of why oxidative damage is bad for us? We know that it's the rusting of our body, so the rusting of our tissue, essentially. And then inflammatory damage can occur locally, like inflammation around the heart, can actually compromise heart's performance. But then there's systemic inflammation, the inflamed brain, for instance. And I'd like to know how it is that, one, you can assess both oxidative damage within the body and inflammatory damage, and then what are ways that we can address either one or both?
Let me answer the second part first, and let's see how I do. So, at some level, inflammation maybe goes to wherever our weak points are. And where are our weak points? Maybe it's social, maybe it's cultural, maybe it's genetic. Maybe it's trauma that we had. And so then when stress is applied, and that stress could be inflammatory, stress could be any level of stress. If that stress is more than an organ system can handle, then that organ system begins to be dysregulated and not function well. When that happens, then that organ system is stressed, but then all of the other organ systems that organ system communicates with then become stressed. The easiest one to understand is the immune system. Everything that I said on a lifestyle front can dysregulate your immune system. Everything at a toxic front can dysregulate your immune system. Infections super dysregulate your immune system. And so, we've been taking care of people with Lyme and mold and every virus that you've ever heard of for a long time, and have found that if we manage your infectious and inflammatory stress down, those organ systems start to come back online. What happened? COVID. There's a huge inflammatory stress or COVID vaccines that began to dysregulate the immune system. But the immune system is embedded in our gut, and the immune system is intimately involved in kind of protecting and managing and creating stability in all of our other systems. And so when that goes sideways, then that system can't do what it's supposed to do, and so then maybe we get immunocompromised and we're more susceptible to more infections. But then the good thing is that almost everything, the way that we heal, the primary thing that realistically that I do is I do injections into every joint, every nerve, every ligament, tendon, and fascia. I do injections into bone marrow. So I do 50 injections a day or 100 injections a day. maybe 20 or 30 or 40 injections on a person. Um, uh, but how do we heal the body? We heal the body with the immune system.
Matt, I just wanted to ask you, just so the group is clear, what's the body being injected with?
Oh, exosome stem cells, peptides, PRP, plasma, saline, dextrose. So I have the cheapest product in the world and the most expensive product in the world, and I inject everything in between. But all of the things that we do tend to regulate the immune system, and the immune system is the key to regulating and healing the body. It's also the key to regulating and healing the brain. So the approaches to heal the brain are immune. And so then to go back to answering to tie it all together, the goal is to optimize our biology, optimize our organ systems, and then the consequence of that is that then our body begins to do what it naturally does when we don't interfere with it, which is heal itself.
If you want to start addressing a damaged immune system, certainly with the concerns after COVID, the fact that we've got new emerging viruses worldwide, who knows if there'll be another pandemic, and making it a lot more local, talking about our microbiome, which you brought up. You said that the immune system pretty much is centered in the bowel. Is there appropriate testing that you would recommend or that you would do for the microbiome? Like finding out what bacteria lives in your stomach that would build a strong immune system? And then can you have an inflamed bowel without having inflammatory bowel disease?
Oh, so I'll answer the second part first. So inflammatory bowel disease is like these major autoimmune conditions like ulcerative colitis and Crohn's that are autoimmune, and so then that's our body accidentally attacking itself. So rheumatoid arthritis would be another version of, that's an inflammatory arthritis. And then that can basically affect any part of our bowel. And when the immune system is attacking you instead of healing, it creates lesions and ulcers and chaos. But then you can have, your small intestine is supposed to be sterile, but if you have a lot of yeast or in your diet, or if bacteria start to live in there, then you get fermentation in something that's only as big around as my pinky. And so then what happens is that creates leaky gut and all of these things. And that's why, when kids are young and they go to college and they start drinking a lot of beer, they get fermentation in their small intestine, leaky gut, and so then you create a lot of visceral adiposity to create that. That's what a beer belly is. And so then we're all somewhere on that spectrum at some level. And then how do you manage that? A huge part of how you manage that is lifestyle. And then the other part is then to begin to test and understand and then kind of project manage it.
Okay. What's the viability of microbiome testing now?
Oh, so then, there's a lot of things that at an immune testing perspective, if I get it, then I will project manage it. The microbiome testing we're doing, and I think is kind of interesting, and my solution to that is that I just keep working our protocols of what we do, and sometimes I feel like maybe a more functional way to test that is to look at your bowel movement. And, there's this probiotic, the seed, and so then basically, what I'm doing is trying all these products, and I've been taking the seed every day for like the last 2 months, and then I went to the bathroom today, and I had like the best bowel movement of my entire life. and so then I just go, okay, I'm totally doing that right. and so, at some level, I'd say that's probably the best microbiome testing, for me. And then if you told me, oh, I do this and I have a better strategy, I would totally buy into it.
If somebody has a history of antibiotic use, and I would say individuals that use it for any bacterial infection, let's say a yeast fungal infection, sinus infection, beyond that, but the ways that Candida can actually get into your system. So how do you then reverse engineer from there?
So then, part of that is a design of. So then the first question that I ask is, in that setting of sort of dysregulation of your intestines, does somebody have bacteria and yeast living in the small intestine or not?
Okay.
If they do, then fruit and sugar and anything that can be fermented. And so there's a lot of vegetables that can be fermented. All of those things cause more fermentation in the small intestine, which drives gas, bloating, and leaky gut. And so then what I do is I try to talk to people and get a sense of where they are, how much gas and bloating they have. If they have a lot, then what I do is I do this breath test called a SIBO breath test. And then I look to see if they have methane or hydrogen-producing bacteria. If they could be negative on that test if they have a lot of yeast. And so then if I'll look at their fingernails or toenails, and so then if I have and you can kind of tell people who are kind of yeast type of people, sometimes they smell a little bit like a brewery. So I'm kind of using everything that I have to get a sense of that. And so then if they're in that category, then I will try to manage that. And so there are antibiotic approaches that are pretty safe because those antibiotics tend to just stay in the small intestine, like rifaximin. But if it's methane, then you got to use neomycin, or there's some other things that you have to do. Traditionally, we've developed protocols where if they have SIBO and leaky gut, but bacterial or fungal overgrowth, we would traditionally have them take peptides in addition to antibiotics, and then we would do herbal antimicrobials, and then and that's that SIBO part, and then in parallel to that, then we build this total approach to healing the gut. So one of them is I do immunoglobulins that bind on to inflammatory stuff in the intestines, and so then that's like a food-based thing, and so then I'll drink that every morning. We will do colostrum. So I put that in my, I have like 3 shakes a day, and so then I put that in my shakes. And then I'm looking at everything that I can possibly find, glutamine and supplements. You can do butyrate. And so we're doing all of these things that are little brick and mortar things of helping the gut. If they've got the bacterial overgrowth, we kind of hold off on the probiotics while we fix that, and then we do a lot of probiotics to replace. I'm a huge believer in kind of the fermented food and natural approaches, and just managing around kind of how inflamed they are to start, and then what they can tolerate on that. We try to teach dietary strategies. So like the dietary thing that I like to do is I'll have people do shakes that are low glycemic shakes in the morning. I have them eat lunch and dinner, and then the strategy on lunch and dinner is to have a salad that is a low oxalate salad. It's another topic, but just remember, that's fairly important. And then I kind of get people to focus on eating protein first, and then vegetables, and then carbs last. And then what happens is if you eat proteins and vegetables first, you generally fill up. And then Barb's here, and then it's this embarrassing to say, but it's also me as a fun person. We have an unlimited amount of time running around the best restaurants in San Francisco. And I was telling people, we're probably hobbits because we always used to go to first dinner and second dinner. We always went to 2 dinners. And, I looked like this before and after that. But then, at some level, once, then this is super interesting. I was like that from the time that I was 6. And then they called me the eagle because I always ate my sister's food. Because she wouldn't finish her dinner, and I would always finish everybody's food when they were done. Once I basically got my biology right, and then once I fixed everything with my liver, now basically I'm like probably the most moderate eater in the room. And if you would have told me that I would have had to suffer to do that, I would have just been like seeing you at my second dinner. But now I barely make it through dinner. So it's interesting. So then once you get basically your systems in line, all of a sudden, I'm just basically here to say it's actually it's 100 times easier than you thought it was going to be. But that's fairly a product-intensive approach, which would be my approach.
Okay. I want to talk about underfeeding. I've been approached often about the role of intermittent fasting, skipping meals certain times of day, and maybe having a day a week where you don't eat and you stay on liquids. Can you tell me what happens in all regards to a body when you fast it or when you underfeed it, and where does it fit in the context of reducing inflammatory damage, oxidative damage, Matt? Then beyond that, can it have an impact on cellular performance, excellence, the destruction of cells that actually should be removed from the body?
Okay, so good. Such a good question. So then, full transparency, so I'm like this 2 dinner a night on the weekend guy. And so then I realized this is a nightmare. And then I found out about fasting 15 years ago, 18 years ago. And so then I was thinking, God, I gotta figure this out. But I was totally failing. And so then I said, I'm gonna start fasting. And so then I heard about this idea of fast 1 day a week. And so then, basically for 5 or 6 years, I did no food, no calories on Tuesday or Wednesday. And I'm running surgery centers back in those days. And so it was at first it was crazy because I just thought, I'm gonna die right now. And then all of a sudden you feel totally normal again. And so then you're like, okay, good. Wait, so what did you say? And then you're going along, and all of a sudden you think you're absolutely going to 100% die. And then all of a sudden it's normal. And so then I deeply encourage people to sort of start to go through that process. And then what happened is I got to a point, and that was my first step in that journey. And this happened for me about 12 or 14 years ago, where if you just said, okay, you can't eat for the next 48 hours, I'd be totally fine. And it basically wouldn't even faze me. But at that time, and so there's a process, just like learning how to exercise, there's a process of learning how to become metabolically flexible. Because once your liver's working, now, at first, it was super difficult, but then what happened is as I started to do that, I think that was probably the initial liver detox, thing that I started to do. When you do that, all of a sudden your immune system gets a break. And so then there's probably benefits at a level of senescence. There's probably benefits at a level of if I'm not loading my liver for 1 day with a bunch of toxins, then I'm going to start to detox and clear that out. And so I think that's a hugely great idea. In terms of then the next thing that we started doing was intermittent fasting. So then for years I would only eat 1 meal a day, and I think that's an interesting and useful thing to do, and that probably has a whole bunch of benefits. And now I'm training a lot, and so then I'm eating quite a bit more calories than I have, and then the arc of life is managing anabolism and catabolism.
Okay.
And so then doing some things that are, I think, intermittently exposing yourself to less food, and then intermittently having some fasts. And so then now I still feel like, so me and Barb still probably like 1 to 2 days a month have just knockdown, drag out, unbelievable. We always say that we want to have basically the best meal in the Bay Area, and I kind of feel like I achieve that like 4 days a week, and but then I still do a little bit, and I think that diversity is probably a really good idea.
So if I want to regulate my aging body and I want to reduce inflammation, oxidative damage, the potential I may have diabetes at some point in my life, heart disease, metabolic syndrome, and let's say neurodegenerative diseases, I want to hit you with 3 words, and the group may not be familiar with them, but I know you can kind of peel them apart and unpack them. Autophagy, apoptosis, and hormetic impact on the body.
Okay, so then where I was talking to Jody, and then I said, hey, what's happening? And she goes, I've had all of my friends come here and all of these people working, and I'm going to have dinner with them and thank them tonight, which I thought was kind of adorable. And the first day of the year is kind of a big day of the year for me, and so our first day of the year we watched Simon and Garfunkel in the park, that old concert, and then they're saying thanks to all of the people that came and helped them put everything together. Autophagy is how your body cleans up. Autophagy is all of the people that are helping and facilitating getting everything done here and cleaning everything up. And so autophagy at a cellular level is how your body just organizes and detoxes and cleans everything up. Apoptosis is that you've got cells in your body, and essentially all the cells in your body are going to need to die and be replaced by new cells. And so to the extent that that is operationally working, then that's great. And then the third one was
Hormesis.
Hormesis, and so then there's, before I go on to that, in terms of autophagy, then there's going to be a diversity of ways that you can optimize and improve autophagy. In terms of apoptosis, when your cells start to age, they can do something where they're still taking up a seat in the room, but they're not doing their job anymore because they're retired. And those retired cells are called senescent cells. And those senescent cells do something where they have kind of an inflammatory phenotype, and they just start to secrete inflammatory things and kind of make a mess, which is blocking autophagy. And so then there are a huge diversity of ways that then you can begin to manage senescence. And so then there are supplements that you can take, like quercetin and ficitin, and that will help get rid of those senescent, or the other word that we use for those cells is called zombie cells.
Correct.
Those zombie cells are more likely to turn into cancer. And so then if we go back to that initial part of our conversation, if we can manage the amount of those cells, and when we have some testing that can look at that, which is going to be super interesting. And then there's a whole bunch of drugs that you can take that will at some level manage senescence. And then the tip of the spear of regenerative medicine is that either doing an IV and taking some blood out, isolating and growing your own killer cells and putting it back in. There's another way. People are ultimately you're going to be able to have off-the-shelf products that are cellular-based, cellular killer cells that people can take that will help manage senescence. There are peptides that help manage senescence, and so then for any topic on health over the next 10 years, there's going to be lifestyle things, dietary things, medication, peptide, and cellular and biological strategies that can optimize that area. And so then, somebody told me, I was like telling him something. He goes, "You don't need to tell me anything." I go, "Oh, why not?" He goes, "I already know what's going on." I go, "What's going on?" He goes, "The product that you have is getting exponentially better, and you're just getting reps putting it into me, and all we have to do is manage and paying attention to what's going on, and as that product gets exponentially better, you will become exponentially better at making me feel good." I was like, that's exactly what's happening.
There's a conversation that's going on about a certain category of products that are called peptides. And I know you're extremely knowledgeable in peptides. I've been using peptides probably for the better part of the last 10 years. What's categorically the advantage of any peptides at all? Why would anybody want to use them? What's the impact on quality of life in the immediacy of life, and then beyond that in the long game, right? So if I want to live long, but I want to live long well, then where do peptides fit in outside of what we've been talking about? Probiotics, prebiotics, postbiotics, nutraceuticals, and so on.
But live long and prosper. That's my goal for all of you. So we are an aggregate of biology. So we have other organisms that are living within us, bacteria, virus, yeast, and then we have all of these cells. And so we are an ecosystem. And so then, just like in the world, inside of our ecosystem, we have signaling molecules that is how our body communicates inside of our body. What are those signaling molecules? One of the primary ones is proteins. And big proteins are called proteins. And then small proteins that are little baby proteins are called peptides. And so then peptides are one of the primary ways that a cell could secrete a little baby protein that went over and told us, "Hey, I'd like you to go do something. Could you go fix that cartilage cell? Or could you come over and start to do some healing in this joint?" And so proteins are one way that our body does signaling. Cells could also secrete growth factors. That's what exosomes are. Cells could also there's a huge diversity. The other big one is hormones. So then within peptides, and there are some peptides that tell our brain to do stuff. And so then they tell our brain to make hormones. There are some peptides that are profoundly important in aspects of neurological function. So for example, Cmax increases brain-derived neurotrophic factor, which is implicated in a diversity of sort of neurological functions. There are peptides that will tell you to make other hormones. There are peptides that are gastrointestinal peptides that are anti-inflammatory in your intestine. There are peptides that calm down inflammation in nerves. There are, and the hilarious thing, if there's any people with influence in the world, is that Oz asked me to come talk about peptides, and so I was like, okay, cool. And so then I get this panic text yesterday morning. The FDA is essentially taking most of the peptides that we use off the market, which is interesting. And this started to happen, and this is happening sort of at a governmental level, and it's happening at a state pharmacy board level all over the country. Which is kind of at a certain level. I always am an optimist, and so it's making an international market. And so then that's a fairly big regulatory stress. And interestingly, I had a great conversation with like a bunch of pharma CEOs yesterday, and they said, well, they're not going to be able to take testosterone away because there's too many people in Congress on testosterone. And so we got that going for us. But to some level, as this information gets out, there's this conversation, and it's a dark statement, but it's kind of a good one, that pneumonia is the old man's friend, or the old woman's friend. And that's because that person who is sick and dying and is kind of dwindling, how do they die? They get pneumonia and then they die. As we age, we tend to have a lot of aspects of our biology kind of fall off a cliff. And so one thing that happens is a lot of times our thyroid hormone starts to go down. Another thing that happens is many of our hormones start to go down. If you did nothing else but just optimize, and this was kind of like when I first got into functional medicine, somebody said, listen, don't worry about it. It's kind of useful to hear like social groups. They go, don't even worry about it. If you just fix their adrenal glands, their thyroid, and their hormones, basically everything else comes online. It's going to be fine. If you add optimizing peptides, the interesting thing, the other thing that falls off a cliff as we age, and that's why pneumonia kills people when they're older, is our immune system falls off a cliff. And when we get immune dysregulation, then that impacts every biological system in our body. And so then the super appealing aspect of peptides is peptides can, everything that I use, stem cells, growth factors, exosomes, peptides all regulate the immune system. And so then the positive is that we've, in our journey on peptides, there are, sometimes there's a whole peptide, and the whole peptide that was the most interesting immune peptide was called thymosin alpha-1. It says a peptide that has regulating and immune stimulating effects, and is quite safe and has been ubiquitously used. Unfortunately, what happened is people started to realize, oh, it's probably fairly helpful in COVID. And so then that is when at a society there was people who were saying the only solution is a vaccination. And so then if the only solution is vaccination, we need to shut down all other conversation. And so then what happened is the first move in this direction was to take away thymosin alpha-1. But then we realized that a protein is kind of a lock and key that does something. Now, it could be that one or it could be this one. And so then the active segment of the protein or the peptide is the part that does this, even though I might be a whole protein and I did this. So there's a fragment of thymosin alpha-1 that may be more potent and more effective than thymosin alpha-1 because it's just like the hand that does the handshake of thymosin alpha-1 called thymulin. And so that's like one of the only ones that they didn't take away because it's real small. I would 100% assume that they're going to take that away also. But you know, at some point, basically what I think is, you know, I'm here, the cat's out of the bag, and we are worldwide, you know, individuals. And ultimately, I think that this is going to be such important and powerful technology that it's going to be here to stay at some level, and it's going to come back bigger and better than ever before.
If you wanted to use peptides and you get educated about them, you work with somebody like you, what are the different delivery systems by which you can introduce a peptide into your body?
Oh, that's a great question, and that's part of my other reason why I'm not super stressed about this. And I did like a kind of a meet and greet with these people, and then they said but there was a bunch of marketing people on the call yesterday, and then they said, "Hey, what's more important, to think positive or not think negative?" And they said, "Not think negative." That's what the data said. And so then, but this is a super positive approach, which is that this protein. How do we get this in the body? So then the first way is that these proteins are basically salts. And so if you looked at it, it just looks like table salt. And so then what you could do is you could take that salt, put it into saline, sterile saline or sterile water. You could take an insulin syringe and then draw that up, and insulin's peptide also. So 30 million people are taking peptides in North America every day. But so you take that and you can inject it with an insulin syringe. And so then, a lot of people that we take care of might do 5 or 6 of those every day, regulating different organ systems. And then we cycle them through a year where they're taking different things that are regulating certain aspects of their biology over the arc of time. Another thing is you can take them, put them in saline, and do them as a nasal spray. And a lot of times you can absorb some, and so then they get absorbed right across your mucous membranes, and then they can have an effect. The big peptides and big proteins tend not to be very available in the gut, at least for systemic absorption, but they might have an effect on the gut locally. Okay. It turns out that the small peptides, like the 2 and 3 and 4 amino acid peptides, are probably fairly absorbable. Let's say that you put those in lipid rafts and wrap lipids around them, you're going to be able to absorb those. And so there's and so then I took something potentially from a drug into a food. And so then that may be a gigantic trajectory, in the next 10 years, which is figuring out how to take those and put them in oral or sublingual, forms. It turns out there's a fairly interesting concept, which is taking those things and then putting them into things that would make them more soluble and putting them on your face or your body. So you're going to be able to absorb them that way. And then a lot of times they'll do healing on the way in. You could do microneedling under the face and then use that as a strategy to drive them in. You can take any of those that are in a liquid form and put them in an IV bag and then drip them in IV, which is like the other sort of primary thing that I do in my life. And then the other thing, which is, for me, as I think about this, and this is just me, it's enormously interesting how interesting peptides are. Because they're a low-cost technology, and so they can be synthesized, and they're super interesting. If I had pain in my knee, I could take an insulin syringe, and I teach people how to do it. And COVID, basically, I had all these people internationally that I was taking care of, and so I started. They were like, "Hey, I had 100 phone calls. They're like, I can't wait to meet you. I live in Kuwait, and I can't leave my country." And so I started teaching people all over the world how to do injections with peptides. I also do a lot of those injections And they're orders of magnitude lower cost than anything else that I do. And so I think there's this incredible opportunity in the developing world to teach armies. First of all, in the developing world, you're going to be able to have distribution models where you're going to be able to have pharmacies that make product that you can do relatively low cost, teach doctors how to do injections. And then those injections compete at some level with the expensive things that I do. And then ultimately, those prevent surgery, and then they lower healthcare costs for society at large. And so then ultimately, everything that I'm talking about was sort of built around a somewhat high-cost cash pay model, and ultimately, it is going to be the cheapest solution to optimal health that exists on planet Earth, and I'm fairly confident about that.
Let's talk about looking better. I'm sure many of you are interested in how do you maintain your appearance as you get older, quality of hair. What are the advantages of peptides in cosmetic upgrading, let's say?
So then there's some peptides that can increase your ability to make collagen. They tend to be helpful for skin. They tend to be helpful for subcutaneous tissue. They tend to be helpful for muscles. In terms of looking good, kind of my philosophy on the face, and then this would be a 100% good one. I'm thinking about and approaching the face and the body, the face basically like we approach the body. And so then when I approach the body, I basically say there's 5 compartments. And so there's the nerves, arteries, and veins. There's the muscles. There's the ligament, tendon, and fascia. And the ligament, tendons, and fascia is kind of the extension of the muscles as they go by the joints. There's the joints, and then there's the bone marrow. And so then what I do is I basically treat all of those things. And so if I was treating your knee, then I might treat, a branch of your femoral nerve. I might treat a branch of your obturator nerve. I might treat your quadriceps muscles and some of your adductor muscles in your joint. And if it was somebody that was 80 and had inflammation in their bone marrow and their joint, I might treat the joint and the bone marrow. So then translate that to the face. And so then what we're doing is we're treating temporalis, we're treating masseter, so I'm treating the muscles, treating the facial nerve, treating the trigeminal nerve. And so I'm treating basically every nerve that goes to the face, working on basically the health of the brainstem, because if your brainstem is healthy, then the nerves, the cranial nerves that come out of the brainstem is super healthy. And so then how do we do that? Could be with peptides, could be with plasma, could be with that PRP, which is platelets from your blood, could be with stem cells, could be with stem cells from your belly fat, could be with other stem cells. And so then you have this huge diversity of things that are we're building from the bone out, and then all of that structure, where the muscles attach, treating that, gets all of that super healthy. Then basically come out to skin. And so then the skin, you've got the microneedling, you've got these laser techniques, and a huge diversity of light techniques that are super helpful. Almost all of those techniques will have some downtime. If you do peptides and stem cells and growth factors around the time of that, and so then we spray those on after big procedures, or we inject them subcutaneously, and so then as we get those in, the regenerative medicine is super helpful at lowering downtime and facilitating healing afterwards. And so then to me, what's going to happen is, and then we will start to have then all of these products in our skincare and drive them in. And so then, and ultimately, as you do that, you're optimizing the extensions of your cranial nerves that are going to your face, and then what happens is those nerves are the way that they branch out into your face is called arborization, and so it's almost like a tree root. That those nerves are like the body of a tree, and then they branch out, and so then everything that we're doing then is going to go into those nerves and make them healthier. And if you make a nerve healthier, then it optimizes blood flow into a tissue bed, which is your face. And so then essentially we've had this kind of somewhat chaotic and broken model of aesthetics, which was driven by basically, the plastic surgery community of putting fillers and toxins in. But then what happens is all of the stuff that I'm saying basically improves the health of your face. And then instead of fillers, we're going to be taking PRP out. You can take blood out, warm it up a little bit, and then use that as a filler. And because it turns into kind of a collagenous kind of mixture that, and then traditionally we were mixing that with peptides, and a lot of that's going to go away. And so then it's just interesting, but then the technology keeps growing so much, and so then everything that you do for beauty from a regenerative medicine perspective is actually going to have probably a net positive overall health. And so then you got to feel good about that.
That's wonderful. I think we've just got a few moments. And there's so much that I would love to talk to you about in terms of reducing infirmities, how it is that you get your infirmities kind of lined up to the last moments of your life, right? Like live a long life, but nothing really breaks down, and it's going to break down, I would suppose, Matt, right? At some point, but you want to keep it to like the last couple of days of your life.
Okay, so then, I've been having this like little question. So then, if you gave me a choice, and so then option one is all of this functional medicine biology, and let's say, and we're 100% into this, and we do this all day long, okay? Or idea two, which is like my idea, which is this: you treat every nerve, artery, fascia, joint in the body, and manage that. If I could only do one of those, I would do choice two all day long. Because what happens is if your body's feeling good and looking good and you can run around and do stuff, that will go longer towards longevity, I predict, than anything else. And then also everything that we inject in the body kind of has the side effect of regulating your biology from a functional medicine perspective. And so then my number one thing is to manage your health, and then what most people do is have little problems, and then they just live with those problems, and then at some point, trauma in life gets you at your weakest link, and then that thing goes sideways on you. If we go out there and then basically take an inventory and then manage all of that stuff, I predict then all of a sudden, 80 is going to be the new 60, because you're just managing, from today forward, your biology, and you're managing that from food basically to stem cells. And so then, and it's easier than you'd think. And then what happens is then all of a sudden you're more active, more vibrant, and then A, there's that, and then B, keeping your brain incredibly vibrant and clear and awake. And if you do that, then I think then that's kind of like some of the keys to longevity. And then you gotta like have a great time. You gotta have a fun time, and then I think it'll be good.
Wonderful. Everybody, thank you so much. Matt and I will be around for a little bit if you want to talk to us. For your health, longevity, and happiness.